Tell me more about what each of you do.
So I work in family practice, so I do primary care. Oh, yeah. We're supposed to be making sure we can be heard. So I work in family practice at the Intermountain West Jordan Clinic, provide primary care there, and then I am the medical director for our ambulatory teleservices, including Connect Care Urgent Care and Connect Care Primary Care.
Okay, awesome.
And I work on the telehealth side, on the urgent care side. And I also am the main provider for school-based telehealth. And so that's what I do.
Very cool. Very cool. Well, if you're just joining us, thanks for being here. I'm Emma Benson with KSL TV, and today we are talking about how to keep you and your families healthy this holiday season. I mean, obviously it's a time of year where there's a lot of viruses and germs going around, so we wanted to discuss prevention tips. I'm here with two Intermountain Health providers. We have Dr. Maurine Cobabe, who's a family practice physician, and Meghann Hilgert, who's a physician assistant and also works in telehealth urgent care. Thank you both for being here.
Yeah.
So as we're talking on this Facebook Live, if any of you guys have any questions for either of these providers, you can drop them in the chat. We'll get those answered. So first off, Meghann, let's start with you. I know that in the past few years, we've seen cases of COVID, RSV, the flu. They've labeled it as a triple-demic of sorts. How are we looking this winter? What should we be aware of?
Right. A lot of cough, colds, and they all look very similar. So yeah, we are seeing the uptick in COVID and flu. It's hard to differentiate between the two. So if you're wanting to know, probably a good idea to get tested. And sometimes, especially in the younger crowds, RSV tends to hit them a little harder. And then in the older crowds, COVID tends to hit them a little harder. And so it's kind of important to differentiate between the two, trying to figure out what's circulating around your household. But yeah, we have seen quite a bit of visits with the cough, cold crowd for sure.
What are the main symptoms to be aware of?
Yeah, definitely fever, cough, head congestion, sore throat, body aches, pretty typical upper respiratory. Yeah.
Okay, great. Well, let's talk about some prevention tips. I mean, because obviously no one wants to be sick during this time of year, especially for the holidays. Dr. Cobabe, what are some main ways that we can stay healthy?
So the real key, I would say, is just trying to get rid of the germs if they're there. So, wash your hands regularly, cough or sneeze into a sleeve or a tissue, and then wash your hands. And then if you are sick, please stay home. Please keep your kids home. If you have a fever, do not go be around other people within 24 hours of a fever. If you've got a diagnosis of flu or COVID or RSV and your doctor gives you advice as far as how long to stay home for, please do that so that other people don't get ill.
Mm-hmm. Great. Anything, Meghann, that you'd want to add?
Ditto. Yeah. If you're snotting and coughing, just keep in mind that you've got this bubble around you to kind of keep people out of that bubble. So yeah, stay home if you're sick. And please be mindful that if your doctor tells you to stay home, it's okay. We're validating that you don't feel good and you can stay home. It's fine.
We'll write you a letter from Connect Care if you need a letter for it.
Love it. You can get a doctor's note. Exactly.
Yes. I will also excuse you from doing dishes over Christmas if you need to.
Great. Well, another important prevention tool, vaccines, right?
Yes.
Can you talk about, what vaccines are available right now and who can get them? I know that we've had some updated shots recently, like the updated COVID shots. So what do people need to know?
Yeah, really important one. Please strongly consider, unless you have a very dangerous allergy, getting your flu and COVID vaccines every year. You may say, oh, well, I got those when they first came out, but they are updated yearly, just like the flu shot, because that virus mutates and changes and can reinfect you because your immune system doesn't know what the new one looks like. And then we do have RSV vaccines available now. RSV, for the longest time, has been a virus that we couldn't vaccinate against, but was causing significant illnesses and hospitalizations in babies and young children and also sometimes older adults. And so we have vaccines available at pharmacies for at-risk older adults over 60 and very young infants that are going into their first RSV season. Depending on if their mom was vaccinated in pregnancy, we have a vaccine for them as well. So we definitely want to encourage people to get those as we go into this fall season and before the holidays come and all those viruses start flying.
Yeah, for sure. Okay, so just to clarify, for RSV, we have a vaccine for pregnant mothers, right? For infants, and then also for older adults.
That's correct.
Okay, great. And then flu shot, something that it's not too late to get, right?
No, not too late. Absolutely not too late. I mean, the flu season doesn't typically end until March, and within the last couple of years, we saw one lingering into May. So it's definitely not too late to get your flu shot. And if you get it now, it'll be kicked in before your holiday parties.
Perfect. And that is for everyone 6 months and older, right?
Exactly.
Okay. Okay, and you touched a bit on COVID vaccines. Anything else to mention about COVID shots?
No, I think I'm covered.
Yeah.
Okay, super important stuff. What about people who may be hesitant to get a vaccine?
Yeah, I mean, these vaccines are heavily studied before they're approved, and there are rare cases of allergies, and if you're somebody with allergies, of course, know that and don't get something you're allergic to. But the complication rate from these vaccines is so low. It's, one in tens of thousands, hundreds of thousands, one in millions that get these unusual complications, and the chances of it saving you from hospitalization, severe complications of one of these illnesses are higher than that. So statistically speaking, it's in your best interest to get those done unless you're allergic.
Right. So the benefits outweigh the risks, right?
Yeah.
Great. Well, again, if you're just joining us, we have two Intermountain Health providers here, Dr. Maurine Cobabe and Meghann Hilgert. We are talking about keeping healthy during this holiday season. If you have any questions about prevention tips, vaccines, doctor's visits, anything like that, please shoot us a message, drop it in the chat. We can get those answered for you. So, I mean, you mentioned you can go to a pharmacy to get a vaccine. It's not too late to get your flu shot or COVID shot, anything like that. What are some other options? You can get it at your doctor's office, right?
Yeah, you can get it at the doctor's office. I know a lot of the schools have flu clinics. I haven't seen a lot of COVID clinics at the schools, but definitely there have been some flu clinics at the schools. I'm sure the health department, that's a good place to get it. A lot of employee health. I'm sure that, the HR, your nurse, employee health is organizing something.
Great. So lots of options there, and that kind of leads us into getting that annual physical or doctor's visit, right? Because they can help you stay up to date on the vaccines. What else can that visit entail, and why is it important?
I will defer that to Dr. Cobabe.
So in general, an annual physical is an opportunity to discuss disease prevention and screen for disease so you catch it early. So you can get those vaccines to prevent communicable disease transmission, and you'll get an opportunity to talk with your primary care provider about lifestyle measures. How can you incorporate the right kinds of physical activity? What should you be eating? Are you sleeping enough? How do you manage your stress levels? Things like that to keep you well. And then you get an opportunity to screen for illnesses before they become very, very dangerous. So appropriate cancer screenings and, are there any specialists that you need to see? Are there any blood draws that you need to do to screen for diabetes or risk factors for heart disease, things that can become a big problem later on?
Right. So lots of good things there. I mean, obviously, no one really wants to have to go to the doctor during this time of year. We're so busy with shopping, schedules, everything, but it's something that you should put on your holiday to-do list, right?
Yes. Yeah.
Because taking care of yourself is important. Give yourself the gift of health, right?
Yeah, absolutely. Just a quick push for our Connect Care services. We do offer those. Our Connect Care is available 24/7, and when it comes to keeping people healthy, I wanted to just share a quick story. My kid had strep and was getting over it, and then last night before I was going to come here and to a big conference later today, I started getting a sore throat. And I was like, oh, no.
Oh, shoot.
And it was after all the Instacares were closed. It was right in the holidays, and there's like, performance practices going on. And it was so convenient to just connect in with one of Meghann's colleagues last night and say, help me out, short notice, I need a strep test. And they got me through so quick from the comfort of sitting on my bed. Yes. It was so good.
Oh, that's good.
And we can do a lot of the same things virtually for preventive care too. Through our Connect Care primary care, we can order all the same screening tests that we would do if you were in your doctor's office. So if you don't have a primary care doctor and you are thinking, oh yeah, I need to do that, that is an option. So definitely look into it.
Yeah, and that's a virtual primary care service, and it's really nice because you can do all of that stuff virtually from the comfort of your home. So we have primary care and urgent care. We have a lot of virtual services. Mm-hmm. Oh, thank you.
You're doing it on the mic.
There you go. Yeah, physical therapy and behavioral health. And then just recently, just the past couple years, school-based telehealth. So it's really exciting. You don't have to leave. Now, strep testing, yes, exactly. Strep testing, yeah, we send you to a lab that's local, that's close to you. And same, my kids, we have a parking spot with our last name on it, I feel like, at our local lab for strep testing. So it is very convenient because I can get it done before the kids have to go to school. So I know if they're germy with strep, and keep them home that day. So I don't have to wait till the end of the day, make an appointment. It's just so convenient.
Oh,
Love
good.
it.
Okay, so lots of options for virtual visits
Yes.
if you don't want to or don't have the time to actually go physically into the doctor's office. So how can people schedule that? Is it just through the Intermountain website, or what's the best way?
For primary care, yes, that I'm not as familiar with.
Yeah, so for primary care, you can Google Connect Care Primary Care and call the number. We do have a phone that can schedule you. It would be pre-scheduled like any other doctor's office visit. Or you can do that through our My Health Plus, the Intermountain platform, to schedule online. But you can give instructions on how to get to Connect Care.
So Connect Care urgent care side, that is no appointment needed. It is first come, first serve. However, our wait times are typically less than 10 minutes. It's pretty phenomenal. And you can reach us you can go to the My Health Plus Intermountain patient portal, and we're an option. And then we also have an independent app, and it's just the Connect Care app, Intermountain Connect Care app. And you can reach us through there, or you can go to our website, intermountainconnectcare.org, and sign up for an account. It's like an Instagram, Facebook account. Do your email, create a password. It's very easy that way as well. And then, those are the easiest ways to get a hold of us. School-based telehealth is a little bit different. That is something that your kiddos have to access through their school nurse or their school health aide, and then the school health aide or the school nurse gives me a call. I'm the lead provider, so if your kiddos do end up with a visit at school, they're likely going to be seeing me. And
We're in which district?
Yes, it's really exciting. This year we had quite a few more. The last couple of years it's just been Wasatch School District, and now we have Weber, Washington, Iron County, and Canyons. Yeah, so it's been really exciting, the growth this year. I love it.
Amazing. Yeah. Okay, so lots of options to be able to connect with your primary care physician or a doctor if you need any help. There's lots of virtual options.
Yes.
If you don't want to leave the comfort of your own home. I did it once when I had COVID. I was able to connect with a provider virtually, and it was so helpful. So yeah, that's great. Well, any other prevention tips or ways that we can things that we can do to stay healthy this holiday season?
Do you want to hear the prevention?
Yeah, let's see. Ways to stay healthy this holiday season. Everything in moderation.
Okay.
Take, the sweets and treats in moderation, of course. Drinks in moderation. Do not drink and drive. Stress in moderation. If it is
Easier
getting
said than done,
the best
right?
of you, go take a walk. Go take a nap. Do what you have to do to cope with that holiday stress, and know that January is coming and you can take a big deep breath.
Right. Yeah.
No, the holidays are wonderful, but they can be a challenging time for a lot of people. So,
Right.
those would be the big things I'd say.
No, I think that's good. Everything in moderation. I mean, the sweets in moderation, that's a little tricky for me.
We just do our best.
We do our best, right? We try to make it a less stressful time of year. Anything else that you wanted to add, Megan?
No, she hit the highlights. Yeah, I mean, just like usual, like we had hit on before, make sure you're washing your hands. Make sure, hand sanitizer, if washing hands isn't available. Washing hands is always number one, though, because there's some things that the hand sanitizer just doesn't kill. It kills the majority, but, make sure that you are washing those hands, covering your coughs. Dr. Cobabe hit that one.
I guess I did think of one more, and that is people may be starting to feel like masks are kind of passé, but you probably still have them. And if you are feeling under the weather, do please wear them if you're going to be in close contact with other people. Or if you're high risk and you're worried about a gathering and that you're worried that you might catch something, go ahead and throw a mask on. They prevent and catch those particles the same way they did a few years ago.
Yeah.
Okay.
Yeah.
Okay. Yeah, I have some cute Christmas ones
Exactly.
still. I mean, so we probably all still have them, you know.
They're hiding in your closet somewhere.
Yeah. Yeah. Okay. Well, thank you both so much for being here, for giving us this great information. This is all good stuff. Thank you all for watching. Again, throughout the day today, we're talking about how to keep you and your loved ones healthy this holiday season. Be sure to tune in for KSL News at noon. On KSLTV.com or watch us in Channel 5. We'll be talking about, diet, exercise, stress, how to relieve from stress, and also how to keep your mental health in check this holiday season. So send us any other questions that you might have, and be sure to tune in to KSL News at noon. Thanks for joining. Thank you both.
Thank you.
Okay, happy holidays.